I mark the mandibular area, I mark the skin laxity of the neck, I observe my patient in the side position, and I mark the more ptosic tissue. Then I make a local anesthesia above the ear. Usually I go above 2 centimeters, and then I go 1 centimeter behind. That I make a local anesthesia. Now I'm using a cannula for the infiltration of the cervical region. This cannula is 25 gauge, 7 centimeters. And more or less I use between 7 and 10 cc of lidocaine to make the anesthesia in all the neck. Then I start with my 2 needles that are joined. Then I separate my needle and I go forward. This movement that I show is to have to know that we are in the right position, in the right plane. Because if not, we can have a problem. We don't have to go too superficial or too deep. Then I exit with my needle. Usually when I make this kind of treatment, I start in above 1 ear, then I go out more or less at the platysmal band, then I go in and I exit in the other platysmal band. Now I'm making a rotation of 180 degrees because this needle have 2 tips, and I go forward and I exit in the other platysmal bands. Sometimes when I have very small patient with a small neck, it's possible to go in above the ear and to exit in the medial region and then to exit in the other lobe. But usually I exit twice in this procedure. Then I make another rotation of 180 degrees. I go forward and I exit above the other ear. In this technique, usually I use 4 threads to treat all the region. With 2 threads, I start, for example, above the left ear and I exit in the right side. And with the other 2 threads, I make the opposite. I start above the right ear and I exit on the left side.